Welcome to Occupational Queerpy, a podcast run by an occupational therapy student exploring the intersection of occupational therapy and the LGBTQIA+ experience. This podcast offers personal perspectives for informational and educational purposes only. We'll be discussing a wide range of LGBTQIA+ topics, and to authentically reflect the community, we'll be using common and slang terms which some listeners may find explicit. Listener discretion is advised. And we are live. Hello everyone. Welcome to Occupational Queerpy. I have a guest today. Who are you?
Hello. Full name?
You don't have to, whatever you want.
I mean, I don't care. My name is Darren Shaneke, and I'm a current second year medical school down at the Arkansas College of Osteopathic Medicine.
Awesome. Okay, and where do you stand in the alphabet mafia?
Ooh, we're a big fan of the letter T. I'm a trans man, and then I also love the Q for queer as far as my sexuality goes.
Awesome. And then pronouns.
I use he, him pronouns.
He, him. Me too. Okay, so I brought you on. Today the topic is physical health, but before we get to that, I want to hear about you. So, can you talk about your experience as a trans man growing up?
So, whenever I try to tell people about this, I always say that I kind of learned about all of this and came out at a really weird time where it was just the beginning of things like really getting to be more well known. Like, there were still only like a couple of like really big trans men YouTubers like doing vlogs and stuff or like documenting their transition. And that's kind of how I found out about it in high school. I was being a nerd. I was watching like cosplay videos and I stumbled across this person who all of a sudden in the span of like a few months of like these videos they would post, their voice just dropped and I was like, what happened here? And that whole deep dive went down and learning about like, oh, there's a word for this. Is this what I feel? Oh no, this is what I feel. Oh dear God, what do we do? I did kind of skip the very common lesbian to trans man pipeline. Mm-hmm. I went straight from maybe I'm bi, I don't know, to oh my God, I'm trans, and then dealt with sexuality after that. So that was in high school, and then it was kind of like my college years were then when like it was a lot more talked about, and all of a sudden like there were more high schoolers who were coming out as trans, or like even in middle school, and it was just like kind of that's when the explosion happened for all of that in my timeline.
And then what was the reception like? Friends, family?
I feel like I got really lucky just in that, like, as scared as I was and as much as, like, everything online was telling me to, like, be prepared to, like, maybe lose everyone, I didn't lose anyone. Like, the worst reaction I ever got was people at some point, like, early on being like, well, I don't really think that's true, but that was kind of it. There was no... Like, my family never threatened to cut off, like, financial support or love me any less. Like, whether or not they, quote-unquote, fully agreed with me was a different story, but they never... Other than that, like, they still loved me and treated me like a child that they loved and cared about and wanted to support in every other way.
That's amazing.
My friends were all really great about it. I joke that when I came out to, like, most of them, like, after, like... I'd come out to, like, one or two individually... And then when I did my bigger group, the response was, yeah, we know. And I was like, guys, what do you mean you knew? It was obvious? It was obvious. It was very obvious. But, like, friends and even people who, like, I wasn't really close with in high school, it was such a surprisingly easy thing to do. Like, no one bullied me at all. Like, again, like, the worst that ever happened was if I was going to the bathroom and it was just someone from a different, like, grade level who didn't know me. I'd get a weird look, but... Never was I harassed, never was I bullied. Everyone, when I came out to like, when I was like fully publicly out, was my senior year of high school. And I got nothing but support and people telling me that they were proud of me.
That's amazing. So where did you, like what part of the country?
I am from a little suburb of Milwaukee in Wisconsin. And it's not even like the most like liberal or necessarily open place. Like there's a lot of like maybe more conservative beliefs or tendencies in that part. of my suburb, but still, I feel very lucky about it all.
That's amazing. I love to hear that. So, being gay and trans, has that impacted, like, you said you're an osteopathic medicine student. Has that, like, led you to be in the healthcare field?
Yeah, I quite honestly, like, being trans and, like, the privilege I've had to medically transition and, like, just having the access to it, being able to, like, financial access and just, like, location access to, like, having competent doctors and surgeons was by and far, like, the driving goal of, like, I want to do medicine. I want to be able to provide this for my community, because I had also, in that same vein, seen so many people who couldn't have access to it, whether it was they lived somewhere else or whether they didn't have, like, the financial means, and being just so angry on their behalf of, like, it wasn't fair that they couldn't access it for those reasons and wanting to make a difference for it.
So has there, as far as, like, gender affirming care goes, you said you transitioned, you came out in high school in Milwaukee. Mm-hmm. We're now in Arkansas. Has, like, the care changed? Like, are you seeing providers here now? And what's the difference? How's it look?
So another big part of, like, everything changing, like, from when I came out, it was initially this idea that you had to go see an endocrinologist. And that has thankfully since, like, by and far also changed. Like, you don't need an endocrinologist for most cases. You can see, like, primary care folks who are more than capable of managing that. And I was able to do that in undergrad. Our college had a really, really great and accessible, like, student healthcare system that provided the, like, doctors that were really competent in it. And it was all free. All I had to pay for was the medication. After college, I was in Illinois, in, like, a suburb west of West Chicago for a year, and it was okay. The person I was trying to see was insisting I go to, like, a special gender clinic, and I'm like, I've been on hormones for years. Like, I don't really need that. I know what I'm doing. I just need someone to prescribe this for me and, like, check my levels once a year. Then I moved to Minnesota for 2 years, and Planned Parenthood was great about it. Ever since coming down here to Arkansas, I kind of came in with the mindset of I need to, like, I guess not necessarily be on the defensive, but I need to do research beforehand. I can't just expect to find something super easily or off the cuff. And so I tried to look ahead of time before starting school and, like, reach out to, like, what was available, what were my options, what was going to be safe. And there's definitely been, like, a slight increase over time, and, like, the more I learn, like, the more connections I meet and people who I learn about, but it's not been as easy to find and to locate down here.
For sure. Let's talk about advocacy for a second. Let's talk about you. We met through the gay club, mm-hmm. is what I call it.
So, I absolutely call it that too.
So the LGBTQIA+ Healthcare Alliance. So on our campus, we have OT, PT, and then DOs, and then we have MSB as well. We have an online.
We have an online Masters of Public Health, but yeah.
Okay. So, yes. So it's a pretty small, tight-knit campus, I'd like to think, and we met in Gay Club, the Healthcare Alliance. So, Darren, what are you in that alliance? You're a powerful person, aren't you?
So, as my second year in med school, the way the school, like our organizations for, like, running for positions for various clubs works, second years are where you can have, like the office positions. So this year I've been the president of Gay Club, which I love. It was absolutely part of, like, what I wanted to do once I came here first for the master's program and then started the med program. And immediately was like, I need to be a part of this club. I need to do everything I can, like, with this club to make sure that it's, like, that we're doing everything we can, and, like, I want to be a part of it. This year has been, I wish we got to do more, and it's also just been really frustrating, especially in the current political climate, like, mm-hmm. wishing we could use the club as a way to, like, do something, but also knowing that we kind of can't in some ways because of, I guess, not knowing if it would be allowed or acceptable.
Right, for sure. The pushback.
Right.
Not just from school, but community.
Community.
River Valley area, yeah.
But what we have been able to do is bring in, there's a local doctor who's in residency, and she's also an alumni here, and she's incredible, Dr. McMillan. She does gender-affirming primary care, and we've had her come talk multiple times to, like, talk to our students for, like, this is what providing this care actually looks like. Like, here's why I do it. Here's the logistics that go into it. Here are, like, maybe some special considerations for these patient populations. Because, like, the education is especially a big thing that I've wanted to help make a difference with in this school, because trans healthcare doesn't need to all be medical. Like, there are plenty of people who don't want those things. But for the people who do, like, we need the proper education. And even if it's not, like, medical care in terms of, like, physical transition or, like, medical transition, you're still going to have trans patients. And, like, you need to know how to respect them, how to care for them, and, like, maybe unique considerations that they have. And it's not an insignificant population of the entire world, yet we don't get much education on it at all in a formal classroom setting.
Right.
And so being able to bring in those doctors to supplement it, which is, I guess, not even the double-edged sword, but just you have the balance of, well, okay, we bring these people in, and the people who perhaps need to hear it the most aren't going to be the ones who come, but we're still educating people who want to learn.
Yeah.
And that's the first step regardless.
Yeah.
But so doing that, being able to help just educate peers and bring up those topics. We've tried to do some volunteer stuff with local, like there's a local temporary homeless shelter for queer youth or like young adults. And then also there's a recent PFLAG chapter that started.
Oh, really? Okay.
Yeah, they just started like this past fall of 2024.
Oh, nice.
And once they get their own feet underneath them a little bit more and get their own stuff going, we're going to try to collaborate with them a bit.
Amazing. So I like that you mentioned that trans or gender affirming care is not, like, I feel like a lot of people like immediately jump, why are we giving kids sex changes? I think that's
my God, yeah.
So when someone says gender affirming care, like, what does that mean?
It really encompasses everything from the basic level of just respecting the person to, like, when a patient comes in, like, okay, how do you begin your intake? Are you just immediately being like, okay, Mr. John Smith, versus, okay, how do you like to be addressed? Like, I'm Dr. Shanicki, what pronoun, these are my pronouns, may I ask which ones you use? When you're doing like a review of systems, instead of just assuming, oh, this person looks like a man, I'm going to assume that there is a penis and testicles in his underwear, being like, okay, we're going to do an organ inventory, may I ask like which ones you have, which ones you don't have, like, or maybe you were born with but have since had removed. Like ways that I think are just like things to talk about and to think of that people can really get caught up in and feel just really panicked, like they don't know what to do. But once you actually give them those examples or those tools, it suddenly becomes a lot less scary. Mm-hmm. And then also ranging from like, okay, like the healthcare of like, yes, like hormones, like what are your goals? What do you want from hormone replacement therapy? And then the other aspect of surgery and all the various procedures that can go along with that.
Yeah, and I think we say gender affirming care a lot, but like that also I think goes in terms of just like, is there a term that's like just queer affirming, or because like I know there's like the gender identity and then there's also sexual orientation. Does gender affirming, when you think of it, does that encompass all queer people, you think? Or
I guess when I tend to think about it, it's more of like a trans and non-binary focus, but it absolutely could be like queer as the broader umbrella.
Yeah. For this podcast, what I'm wanting to do is just create a space for conversation for, this is directed towards OT practitioners, but just create a conversation where people can discuss queer topics, just so people are able to, we'll never understand everything, right?
No. But, and that's kind of the fun part.
Exactly. So just like creating a space where it's okay to ask questions and just like, we're all going to have different answers too, right? So just finding a place where we can talk about this stuff, and that will hopefully make the practitioners or whoever's listening more comfortable if they have like a queer client, just eliminating like some of the stress. Is like, how do I go about asking for pronouns? It's like you said yourself, like put on an intake form or just say, how would you like me to address you? So just like simple things like that, I think, are powerful. Like it seems so like menial, but like it adds up for sure.
It really does. And like, sure, maybe like of 100 patients or clients that you see, for 90 something of them, it's not really going to apply to them, or maybe they'll even be confused, like, why are they asking me my pronouns? But for the ones that do, like, it really matters. And also, even for the ones that maybe doesn't necessarily apply to them, it lets them know that you are a safe place, you are a safe person for their own loved ones and their own family or like friends, to know like, oh, hey, this person, even though I'm not trans or queer or anything, they were still in a really open about all of that regardless, and making them feel a lot more comfortable recommending them to other people.
That's amazing. Yeah. Physical health disparities. Let's talk about them. So I feel like the first one we need to touch on is HIV/AIDS. Mm-hmm. So that's a really big one. So what do you think of that?
Oh, a lot of thoughts and feelings.
Do you know like the history of? Are you able to give like a brief history on the HIV/AIDS epidemic? Or
I'm not great with the specific dates. I know like the general, like it was in the 80s. It was especially gay men, and because it was gay men, it was initially seen as this kind of
gay disease.
It was this gay disease, but also it was like this not comeuppance. It was what they deserved. It was like God smiting them for their sins. And like people, like the outrage was not appropriate. It was very subdued, and there was also just so much misinformation. Like we didn't understand it, and a lot of like reasonable fear because it was killing people, and we just didn't know why, or like why it was doing what it was doing. And then unfortunately it took from it finally spreading further out and affecting like the cis straight white men, for the public to finally kind of realize like this is a problem, this is a public health problem, like we need to work on this and try to like find some treatments for it.
Yeah. I have some stats here. So while there is treatment now, there's still like the new HIV infection. So in 2022, there's an estimated 71% of new HIV infections in the U.S. were among gay and bisexual men, with Hispanic, Latino, and Black gay and bisexual men receiving diagnoses at a significantly higher rate than their white counterparts, and that was from the CDC. While people who identify as trans only make up 0.3% of the U.S. population, trans people made up 2% of HIV diagnoses, with Black trans women receiving HIV-positive diagnoses at 3 times the rate of other trans white counterparts. So I think definitely alarming.
Yeah.
Studies also suggest higher rates of certain cancers, such as breast and colorectal cancer, among queer individuals, and that's from the National Cancer Institute last year, actually, 2024.
Oh.
And then research also shows that queer individuals may experience higher rates of cardiovascular disease compared to the general population. And that may be influenced by factors such as higher smoking rates, lower rates of physical activity, substance use.
Yeah, it's funny, the cardiovascular specifically, because I am actually currently working on a paper for that, like specifically with a trans lens, but it's just really funny how, I guess like with the trans lens specifically, people are so quick to jump in to blame the hormones and just completely bypassing and ignoring like all this other previous research that like the American Heart Association, all this are saying for like risk factors of smoking, stress, like the activity, like all these lifestyle things or like social determinants of health, and instead are just so quick to demonize the medications when there's actually so much conflicting evidence of like, well, are they actually like, are they playing a big role? Is it significant, or is it actually fairly minor? But all of the things, like, I don't know, I feel like people love to find like chicken or the egg kind of a situation.
Right.
But the bottom line is like what you were saying with like the intersectionality and just minority stress theory and all these other things of if you have all of these other stressors on top of like, can you afford healthcare? Are you in a place like that has like reasonable wait times to access that healthcare? Do you have doctors that are going to respect you? Like I know so many people who, and myself included at times, where I didn't want to go find a new doctor because I knew that unless I was going to someone that already had a good reputation for being like just competent with queer knowledge, I was going to have to play educator. And it was exhausting and it was frustrating to have to like aggressively advocate for myself to get the healthcare I knew I needed. And that's speaking from someone who was fortunate enough to like have an education of my own healthcare. Like if you don't know it, that makes it all the harder because you don't necessarily know what you need or what you should be fighting for, and it also just makes the whole process a lot more daunting and scary.
You're becoming a doctor, and as a doctor, you still have difficulty.
Oh my God, yes.
Navigating the healthcare system, which is so incredibly frustrating. Like, and I think it's sometimes something that people don't think about. Just affirming care, like cis straight people don't typically have to think of that. They just like go on the Google and type in PCP or I need like a family medicine doctor, something like that. And there's so many more hoops that we have to go through just to make sure we are taken care of how we should be. I was looking for PrEP medication, and for the folks at home, that's what's the word? You're the doctor.
Pre-exposure prophylaxis.
Yeah, so it reduces chances of contracting HIV when you have sex.
Yeah, specifically I think for unprotected sex.
Yes.
Usually too.
So I was looking to get on that. Not that I wasn't a hoe. Don't look at me like that.
I love a hoe phase. Everyone deserves one if that's what they need.
See,
I'm never going to judge for that.
The thing is, I wasn't even going through it. I just heard from my queer friends, they were talking about it, and like, better safe than sorry.
Yeah,
and if I could
exactly.
get it with my insurance, like, it was, supposed to be covered. So I'm like, I mean, I might as well, right?
Yeah.
Because you never know. And I went to the doctor. Okay, it was actually a doctor in Fort Smith, and I asked them, I'm like, hey, do you know anything about PrEP? I would be interested in getting on it. And they essentially told me, like, we don't do that here.
What do you mean you don't do that
yeah,
here?
I'm like, I didn't even know what to say because I'm also in the healthcare field, so I feel like I have a little bit of knowledge on, like, the medication and stuff. But I didn't know they could just be like, yeah, we don't really do that. So I'd been seeing that PCP for a bit, so I had to go find another one. I ended up finding one like right by campus, which is really nice.
Oh, that's
he's
cool.
a resident. He's super chill. Like, he's incredible. And he always asks, I can talk about this for a little bit, but from the jump, he always asks like what my dating life is like. Like, do I date men? Do I date women? Do I date anyone? And I just had that conversation with him immediately, and I knew, I'm like, okay, this is good people. This is good people. And now every time I come in, he's like, how's the dating life? Like, how are you doing? It's just so easy, and I feel like I can talk to him so easy. So he ended up being able to give me PrEP, and now I'm no longer on it. I'm in a monogamous relationship.
Cute.
So thank you. And I'm just not on it anymore because the anticipatory hoe phase is no longer. So, yeah, just a lot of hoops that some people don't have to think about. But it's a sad reality for us, a lot of other queer people, and then on top of that, queer people of color in rural areas. Like, it just, like, the intersectionality, like, different identities, it builds and builds and builds, and it's shitty. It sucks.
Yeah. A lot of my own, like, education and history on the topic came from a mix of the documentary Paris is Burning.
Period.
And then also, what's that really great, it's set in the 80s with ball culture. Pose, yes. Learning a little bit of it through that. And obviously in that specific lens, like, a large part of that community, like, they're also sex workers.
Yes.
And so the amount of stigma that you have to also be facing of like, because one, testing isn't cheap, especially if your insurance isn't going to be working with you for that. But if that's also your livelihood, like that's got to be so terrifying, and like the stigma that's going to come with it of like getting tested, and even if you're making good, safe choices, like people can still make the assumption of, oh, you're getting tested and therefore you must be worried about something. And it's, no, I'm making these good, healthy choices for myself. And it's,
Yeah.
you're damned if you do, damned if you don't.
Right. Like there's a stigma even if you do,
Mm-hmm.
if you're trying to practice safe. And there's also the fear of like, you don't want to know.
Right.
You know, it's
right.
like, okay, what if I have it? Not only do you have like a disease like an STD or HIV or something, like you're out of a job.
Mm-hmm.
Like financially, like that's what you do. So.
And also, like, for a long time, it was a death sentence, and I think that really stuck with people. And even though it no longer is,
Yeah.
it doesn't have to be. Not everybody realizes it, because again, if you don't have that access or that privilege to have the amount of like medical education, if you simply don't know and you're just hearing everybody say like getting HIV/AIDS, like that's it for you, like that's going to be paralyzing with fear.
Yeah. And believe it or not, this is going to sound crazy, there's not a lot of HIV education in the South, in rural.
There isn't?
No.
Wow, I'm so
no.
shocked.
So,
I'm so
yeah.
shocked.
I think we talked about it in health class, like in 7th or 8th grade. It's just like, yeah, not good. Gay people get this, and essentially you're effed if you get it. And that was the topics.
Mm-hmm.
Yeah. And for undergrad, I got a degree in biology, so I like to think I'm supposed to be well-knowledged on that. But I feel even with that, like I still know so little.
Mm-hmm.
And yeah, it just makes me think people who don't have the ability or unable to seek education like that, like...
Oh, I genuinely, it was only, one, like my medical education, and two, just again, because, like, undergrad, like the knowledge I got from it had nothing to do with my major being pre-med or like anything. It was because I went to a university that had a minor in LGBTQ plus studies.
Wow.
And so they had, most of the classes for it were under like the gender and women's studies program, but there were other things like that could count towards it. It's like more of the biological sciences for some of it, but just having like being surrounded by people who knew about this at that level and like could talk about it and could educate on it, like that was the only reason I had any amount of like decent knowledge before med school. And even then, like how it actually works and like the actual course of the virus and more of the history and like the treatment and the actual outcomes and like the reality of it all, that was med school.
Yeah.
And how many people are going to med school? That's such a niche, like
Right.
small amount of the population in general.
That's incredible that there's like a queer minor.
I know,
Like that is so cool.
It was lovely. I also literally lived on like the gay floor in undergrad because we had like learning communities.
Yeah.
I went to UW-Madison. Shout out, love it. Great state school. It was in Phillips Hall because like various learning communities, because like massive campus. There's over, I want to say like 12 or 13 like dorms alone, and most dorms would have a learning community. So there was like women in STEM, or there was like art studio, or there was like greenhouse, or all these like various things. And in ours was at the time called open house learning community. And so we were partnered with the gender and women's studies department, and it was placed in that dorm specifically because it used to be an old hotel. So every single room had a private bathroom.
Oh,
And so it was a great way to ensure like, hey, if you need that safety and that privacy of not having a big shared bathroom space with like a whole floor, this was a great place for you to live.
Oh,
And
that's incredible.
so I lived there the first year and a half, and then I got to become like the RA for it later too.
That's amazing. Okay, so I kind of want to go back to the gender affirming care. So like we were talking about, like people kind of jump to medical, but there's so many different ways that you can be affirming without like, we're not jumping to sex changes, okay? So how, like, OTs, do you know what OT is? Can I quiz you?
Please do. I want to see if I get it right, because then if I'm wrong, I will be heckled later by friends.
And you're going to be kicked out of the podcast.
Oh,
I'm sad
well,
to say.
I accept my fate. Please do your worst.
Okay, what is OT when you think of OT? What's it stand for?
Occupational therapy.
Wow, okay. Okay, and what do OTs do?
So, because I know there's like a lot of confusion on how do you differentiate between a physical therapist and an occupational therapist.
Preach, yeah.
And so an occupational therapist is someone who is, I guess let me start with how I compare them. So physical therapy, in my mind, is if you're starting with someone who they had a baseline level of some kind of like activity or ability to do something, and for some reason it is now below that. A physical therapist is going to try to get them back to that baseline for just like whatever it may be in like every aspect. Mm-hmm. Whereas occupational therapists, I think it's a lot less focused on like trying to quote unquote fix or cure. It's more of just figuring out, okay, you're unable to do some kind of activity that is important to you. How do we get you back to being able to do it within what you were working with? So whether that's like your actual physical like livelihood in your job, or like is it something that is important to you outside of monetary value? Like, is it a hobby? Is it just something that is important to you that you like to do throughout your day? And how can we modify that activity so that you can do it and it's not like putting unnecessary like physical or emotional stress on you to do it? And so like I'm sure there is some amount of like rehabilitation, but it's not with the goal of we're getting you back to baseline. It's
repairing
how do we make the activity match what you can do instead.
That's amazing. That was incredible. Do you want to be an OT?
Honestly,
Transfer real quick?
The more I learned about it, the more I was like, this would have been an incredible backup because I love it.
Isn't it crazy? So we have, like, your friends, they'll be on the podcast, but we had some people that were working, like, at our school, and then they ended up joining the OT program.
That's so fun.
So I'd like to think it's because we're so fun.
Yeah.
And everyone loves us. So
I mean, I know everybody can't see it, but we are literally in, like, a playroom. There's a ball pit. There's a swing. There's so many toys, and it's like, these people get to have fun. They get to do cool stuff. Meanwhile, I'm always sitting in like a boring lecture hall and wanting to cry. Like, this is just way more fun.
They look very sad, the DOs.
We are very sad. We are always stressed. We are always like, oh, when do we get to have free time again? The answer is never.
Oh, gosh. Okay, so OTs, gender affirming care, you can incorporate that into all OT practices. Don't you? Do we concur?
I would absolutely concur.
Can you give some like examples of like what people can do no matter what setting they're in? So let's say like inpatient or mental health makes sense, obviously. Peds, acute care, outpatient.
I think starting again with the base, like just the baseline of like respecting the patient or the client and being able to say like, hi, like, okay, like, what are your name? Like, what name do you prefer? These are my pronouns. What are yours? Just to make sure they feel comfortable and safe with you on that sense. And then even if it's not medical, like the clothes that people want to wear, like how they want to do their hair, how they want to present themselves to the world. And I know OT can really go into being able to like do those things for yourself.
Yeah.
So yeah, like personal grooming or like just ways of how you want to manage your own appearance. And then also, if that person needs help with, okay, this is the way I want to present myself, this is how I want to be perceived, how am I able to then meld that then like with my hobbies or with my profession, maybe in a way that OT can really come in and help with, where I guess I know this isn't OT specifically, but like voice therapy or like different ways to walk. Like if you're trying to quote unquote pass and like have a more feminine or masculine way of doing certain activities, like if they have insight to that.
Little simple things we can do, like putting preferred pronouns or preferred name on intake forms and stuff. I think that immediately, like a lot of people, like the majority of like straight cis people will be like, obviously I'm a man, obviously I'm a woman, like who cares, like that's a stupid question. But for the people that like it actually applies to, that will let them know that like, okay, these people like are looking out for me, like this is going to be a safe space or it safer, you know what I mean? Because there's still like that hesitancy, like just creating that comfort right off the jump is a good way to like, it will help build rapport with the client better, and that will overall improve like occupational therapy outcomes, you know? So I think it's really important to just start with the little things, if anything, and it will make a big difference.
Yeah. And then also, like, even if OT itself is not like doing those medical procedures or like doing hormone, but like if they do suddenly have, like if they undergo surgery and they have those changes of, okay, they went from having breast tissue to now they don't, or now they do have breast tissue, or types of bottom surgery, and if they need new ways of learning how to navigate their body, because a lot of people, I think, experience after surgery, like they've spent so much time like wanting this, and by no means do they regret it, but it's still such a fast, quick, sudden change. Like when you do hormones, like it's a very gradual change, or like it builds. It's not you don't wake up and you're 6 feet tall with a beard and muscles. As much as I wish I would have gone that way, that's unfortunately not what happened. But like when you wake up from surgery, it's this is radically different. And having, I think, especially someone in OT, if you could have that support of, here's how you navigate your body now, or like ways to things you didn't need to consider, or even without surgery, like as a trans guy, everyone is like, okay, like your basics are you get a binder and you get a packer. And it's like, I have no idea how to walk with something in my pants like that. Or like, how do I sit? What do I don't know what to do. And so, especially if it's something as permanent as surgery, like learning how to just like, once again, I'm repeating myself, but like, how do you navigate your own body and being able to be working with it while still doing those things that you love? Like if you were a horseback rider, or if you love to ride motorcycles, but now you've just had these like very intense surgeries, after you recover from them, like relearning or refiguring out how to do that and having an OT to help you with, I would imagine would be really, really helpful.
Yeah, for sure. And I think I feel like just it could be intimidating, like approaching something. Like you'll never know everything. So like when you're going in with a new client, like it may be a learning experience, but like you'll be learning together, and the client having someone on their side learning that, like that will help exponentially, rather than like you going in and just being like, I don't know what to do with the penis. Like, I don't know. So I think just like being open and like ready to help and say like, hey, I'm willing to learn. Let's do this together. Will do leaps and bounds.
Absolutely. Yeah.
Okay. We're kind of wrapping up here. So Darren, talking to the audience here, if they can take away one thing from this discussion, what would you like for them to hear?
I think, at least in terms of like the medical perspective or like a healthcare perspective, the biggest thing you can do to help yourself is just embrace the discomfort and don't go in with assumptions. It's so much easier for everyone involved if you go in with this very neutral view of like, whatever they tell me is fine and okay, and I'm not going to assume based on what I'm seeing. So like, and it goes into everything of like the name, like the organs that you've got, the pronouns, like just go in with I'm going to ask them, I'm not going to assume, and it's going to work out from there. I think can save a lot of that panic and that discomfort, and then also just make things easier for the patient and your relationship with the patient in general.
I really like the normalizing it. Just if it becomes a standard part of your practice, like it's second nature at that point. Like every single patient you go in, just be like, it's part of the process. And I think that just like simplifies it, but it's also super impactful. Are there any like resources you suggest if people want to learn more about like queer health?
There are lots and lots. As far as like trans health, online there is WPATH, so like WPATH, and that's like the World Pediatric Adolescent Trans Health, maybe? It's like, it has great guidelines for trans health. I know there's like the Trevor Project, there's is it the equality? What's the little equal sign?
HRC.
Human Rights Campaign. Yeah, that one. And and like various like big name universities, like I think there's some in California. I know like lots of different universities, like Harvard as well, like they will have all these resources for like various aspects of health. And then even some hospitals will post their own things for like if they have like gender clinics or like just queer health in general that they prioritize, like they'll be very open sometimes with here's how we do it, like here's like what we're prioritizing, like how we go about certain things, and like various information resources. I think there's a lot, and like picking one or like one that's the best can be hard, but just and some of them might be a little bit more like region specific. Like, are you working in the South? Are you working on the West Coast? Are you working just more rural?
Yeah.
But yeah.
Sweet. Okay, well, I think that's it. Do you want to close out with a song?
Oh, can I do the knee drums, the leg drum?
Yeah, go for it.
Oh, you're singing. I'm not. I'll do the beat.
Oh, well, what beat are you doing? I got my ticket for the long way round. 2 bottles of whiskey full away. And I sure would like to speak. Okay, that's it.
I love you, Trent.
Darren, thank you for coming in.
Thank you
was
for having
amazing,
me.
super informative. I like you, even though you're a Dio.
I miss you so much.
I miss you too.
Even though you left me.
I did. I was in Chicago though.
You were in.
I went
Chicago.
to see where you used to be.
You were in Boys Town. You were living a great.
Okay, see y'all.